In this video, I'll be presenting information from Chapter 8 of Human Anatomy and Physiology, 11th edition. This chapter focuses on joints. And in particular, let's look at some examples of major synovial joints. So these are going to include the shoulder, the hip, and the knee joints. So let's start with the shoulder joint. This is also called the glenohumeral joint. This is the connection between the glenoid fossa, or glenoid cavity, and the humeral head. So this is the most freely moving joint in the body. Remember from a previous video, that's thanks in part to the shallow nature of that glenoid fossa. And that means that stability is decreased, and it's being sacrificed for that freedom of movement. This is a ball and socket joint, meaning it's going to be moving in multi-axial fashion. And it is the large head of the humerus fitting into that small, shallow glenoid cavity. And that's part of the scapula. The articular capsule that encloses this particular cavity is pretty thin and loose. And again, that is less stability, but extra freedom of motion. Next, we'll move to the hip joint, also known as the coxal joint. This is another ball and socket joint, but in this case, we have the head of the femur articulating with a very deep depression, the cup-shaped acetabulum. So in this case, it's still a pretty good range of motion, but the motion is limited by that deepness of the acetabulum, and that's to basically sacrifice freedom of movement for stability. And in this case, there is something called the acetabular labrum. And so you can see that's shown up here. It's labeled, and I guess they colored it in orange. This is going to be a rim of fibrocartilage that's going to enhance the depth of the socket. So remember, fibrocartilage is that extra tough type of cartilage. And so in this case, there's just a very small piece of fibrocartilage that is reinforcing that edge of the acetabulum, or the rim of the acetabulum. So now we'll move down a little further, a little more inferior to the knee joint. So it turns out the knee joint is actually 3 joints that are surrounded in a single synovial cavity. So this is, considering the knee joint, because it's actually 3 joints in one, this is the largest and most complex joint of the body. So it's going to include these 3, the femoropatellar joint, the lateral tibiofemoral joint, and the medial tibiofemoral joint. So those were ridiculous words, but if you look at them, hopefully you're going to see the 2 bones that play a part in each joint are actually in the words. So femoro is femur. So the femur is one part of that joint, and patellar is patella, so that's the other part of the joint. It's the joint between the patella and the femur. And this is going to allow for that gliding of the patella over the knee, over the femur during knee flexion. The lateral tibiofemoral joint is going to be between the lateral femoral condyle and the lateral meniscus of the tibia. So tibio is tibia, and femoral, again, is femur. Medial tibiofemoral is medial. So you've got the femoral condyle, the medial femoral condyle, as well as the medial meniscus of the tibia. All right, so now that we've got that under wraps, so those 3 joints in one that we call the knee, now we can think about how to stabilize the knee. So anyone who's an athlete has maybe at least been next to someone who has experienced the limits of this stabilization, if, for instance, they've pulled some of these different ligaments. But this is anterior stabilization of the knee. So basically, these are going to be at the front of the knee. And we have 4 things that are stabilizing anteriorly. So the fibular collateral ligament. So fibular collateral ligament, you can see over here. It's connecting between this femur and the fibula. The tibial collateral ligament, again, the femur to the tibia in this case. The patellar ligament is between the the tibia and the patella. And finally, the tendon of the quadriceps femoris, that's a muscle. So it's connecting the quadriceps femoris muscle to the patella. So that's providing a lot of stability all around the front side of this knee joint. There are also some ligaments that are going to help to prevent excessive anterior-posterior movement, and these are the intracapsular ligaments. And you've probably heard of at least this one, the ACL, the anterior cruciate ligament. But these intracapsular ligaments are also known as the cruciate ligaments. So we can see here they are intracapsular ligaments. I'll actually remind you from a previous video I talked about these as being deep to the fibrous membranes of articular capsules. So the anterior cruciate is called that because it attaches to the anterior tibia on the lateral condyle, and the posterior cruciate ligament is going to attach the posterior tibia, so it's back here, to the medial condyle of the femur. So there's even more structure in the knee joint. This gets us to the hyaline cartilage that's present, and this is a little extra for the knees, and the hyaline cartilage makes up these things called menisci. So these are meant to reduce friction, but additionally they also stabilize. They're preventing side-to-side rocking of this particular joint, and they're absorbing shock at this joint. So there are two of these. They're both C-shaped, so you can kind of see the letter C on this one. That's the medial meniscus. The lateral meniscus, just turn it upside down, and it's also a C. But those are the two, medial and lateral meniscus. And here is a question related to that information that I will leave you with.